Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the embryology of the umbilical vessels and the ligamentum venosum. Let's start with the umbilical veins, then we'll go to the umbilical arteries. Then we'll learn a few ligaments linked with the umbilical vein and umbilical arteries. There are two umbilical veins initially and passes on each side of the liver and they connect to the hepatic sinusoids. The proximal part of both the umbilical vein, that means the left umbilical vein, right umbilical veins, and distal part of the right umbilical vein then disappears. So what is remaining? That is the left umbilical vein. The remaining left umbilical vein carries oxygenated blood from the placenta to the liver. The placenta increases in size gradually and the oxygenated blood reaches the inferior vena cava via the ductus venosus. After birth, the left umbilical vein becomes ligamentum teres hepatis, also called round ligament of the liver. The ductus venosus become the ligamentum venosum. Okay, so initially duct, then the duct is closed and we'll get the ligamentum venosum. Okay, so this is the embryonic cardiovascular system, approximately 26 days, showing the vessels on the left side, one side is showing. Okay, umbilical vein carries oil oxygenated blood and nutrients from the chorionic sac of the embryo. The structure here, this is the umbilical vein. Okay, and this is the umbilical artery. So umbilical vein here is shown in blue and the red is the umbilical artery in a 26-day embryo. This is the left side. Okay, we got that. And the umbilical arteries carry poorly oxygenated blood and waste products from the embryo to the chorionic sac, the umbilical artery. But the umbilical vein, this is although shown blue, this is blue, umbilical vein, they carry oil oxygenated blood and nutrient from the chorionic sac to the embryo. So again, this is the embryonic cardiovascular system. We have the common cardinal vein, we have the umbilical vein, we have the vital vein, all opens into the sinus venosus. Umbilical vein are coming from the chorion of the placenta. Umbilical arch to the sinus venosus. Initially, the liver and the septum transversum has not been shown here. There is no hepatic sinusoid yet. And this is the dorsal aorta. We are getting the umbilical artery. Initially, we have two arteries, left and right umbilical artery, and we will have two umbilical arteries. Initially, we have two umbilical vein, left and right umbilical vein. Then we will lose the right umbilical vein. The remaining vein is the left umbilical vein. Okay, we got that. Now, if we go to the fetal circulation, we'll find out that, okay, this is the ductus venosus. It connects the left branch of the portal vein to the inferior vena cava. Okay, this is the inferior vena cava. And this will be eventually the Ligamentum Venosum. This is the fetal circulation. After birth, it will be ligamentum. It will be the Ligamentum Venosum. So the blood from the placenta is diverted to the inferior vena cava, around 50% above amount of blood that coming out through the umbilicus goes through the ductus venosus that connects the left branch of the portal vein to the inferior vena cava. Okay, it is shown here the umbilical artery have high oxygen content. The umbilical vein has high oxygen content, not the umbilical artery. The umbilical artery, these are the umbilical arteries, they have medium oxygen content. Okay, we got that. That is medium oxygen content. And this is the inferior vena cava. It has the poor oxygen content. So who has the highest oxygen content? There is the umbilical vein, not the artery. Medium oxygen content is in the descending aorta and the umbilical arteries. Poor oxygen content in the inferior vena cava up to this level. Then inferior vena cava, this part contains oxygenated blood because the umbilical vein blood, most of the blood, around more than 50% blood bypass the liver, goes to the inferior vena cava via the ductus venosus that connects the left branch of the portal vein to the inferior vena cava. Okay, we got that. Umbilical artery, initially the paired umbilical arteries are branches of the dorsal aorta and reaches the placental chorion via the primordial umbilical cord. If you look at the previous image, okay, so here this is the dorsal aorta. We are getting the umbilical artery. It connects the dorsal aorta to the chorion. Okay, we got that. And we have two umbilical arteries. We have initially two umbilical veins, then we have only left umbilical vein. Okay. At 4th week, the umbilical arteries get secondary connection to the common iliac artery and is separated from its initial origin from the dorsal aorta. It goes further down. After birth, the proximal part of the umbilical arteries become internal iliac artery and the superior vesical arteries. After birth, the distal part, simultaneously with that, the distal part of the umbilical arteries are obliterated. Obliterated means the lumen will be fibrosed and closed and become the medial umbilical ligament. Okay. So what is ductus venosus and ligamentum venosum? Ductus venosus connects the left branch of portal vein to the inferior vena cava. It carries the oxygenated blood via the left umbilical vein. Okay, this is the left umbilical vein and this is the ductus venosus. This is on the fetal liver. After birth, it will be the Ligamentum Venosum. Okay, the ductus venosus becomes the Ligamentum Venosum and is visible on the visceral surface. Here is the visceral surface of the liver. So let's get some highlights of our today's discussion. Left umbilical vein, initially right umbilical vein, left umbilical vein, then we'll get the left umbilical vein. So left umbilical vein will be the ligamentum teres hepatis or round ligament of the liver. Paired umbilical arteries. Initially, they take origin from the dorsal aorta, then from the internal iliac artery. Ductus venosus connects the left branch of portal vein to the inferior vena cava, and it carries blood, oxygen-rich blood from the umbilical vein. Ligamentum teres hepatis. This is the remnant of the obliterated left umbilical vein. Internal iliac artery and superior vesical artery, they are developing from the umbilical artery proximal part. Medial umbilical ligament, they are developing from the distal part of the embryonic, or you can say the fetal umbilical arteries. It will be the medial umbilical ligament after birth. Okay, and that's all about the umbilical artery, umbilical vein, ligamentum venosum, the ligamentum teres hepatis, and the ligamentum, and also the ductus venosus. So if you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.